Exclusive. Amanda Pritchard's departure from NHS England follows critical scrutiny and meetings with Wes Streeting. The health service is reeling from the shock announcement of Amanda Pritchard's resignation as chief executive of NHS England. Her departure, after 3.5 years at the helm, comes swiftly after a pivotal meeting with Health Secretary Wes Streeting on Monday. While sources insist the exit is amicable and not forced, the timing is undeniably significant, occurring less than a month after two powerful House of Commons committees issued unusually sharp critiques of her leadership. These criticisms, questioning her fitness to guide the NHS through its most ambitious restructuring since its inception in 1948, a transformation repeatedly emphasized by both Streeting and Labour leader Keir Starmer, cast a long shadow over her tenure. The Public Accounts Committee (PAC), in a highly publicized report, labeled Pritchard, her deputy Julian Kelly, and two senior Department of Health and Social Care (DHSC) civil servants as complacent and lacking the necessary dynamism to navigate the complexities of the impending reforms. This damning assessment wasn't an isolated incident. A mere 12 hours later, the Health and Social Care Committee (HSCC), fresh from a 2-hour evidence session with Pritchard herself, publicly voiced their own reservations about her leadership capabilities. The convergence of these criticisms from two influential and independent committees created a considerable pressure point, adding context to the timing of her resignation. The committee's concerns extended beyond mere personality assessments. They touched upon the fundamental questions of strategic leadership and the efficacy of the NHS's current organizational structure. The PAC report specifically highlighted a perceived lack of proactive strategic planning and a failure to effectively address mounting challenges within the system. The HSCC, meanwhile, expressed concerns about the lack of clear accountability mechanisms and the apparent disconnect between strategic goals and on-the-ground realities within NHS trusts across the country. These critiques underscored a deeper systemic issue, raising questions about the overall effectiveness of NHS England's leadership and its ability to deliver on the ambitious goals outlined in the government's long-term plans. Pritchard's departure, while described as amicable, undoubtedly reflects the weight of these criticisms. The unusual swiftness of the committee's actions, the severity of their language, and the subsequent resignation create a potent narrative of accountability, implying a degree of pressure that ultimately proved insurmountable. The timing, just prior to the implementation of the 10-year plan and the start of a new financial year, further emphasizes the significance of this leadership change. These pivotal junctures in the NHS's reform process necessitate strong, decisive leadership to navigate the significant challenges ahead. The interim appointment of James Mackey, the highly respected chief executive of Newcastle upon Tyne Hospital's NHS Foundation Trust, provides a degree of continuity and stability. Mackey's strong reputation within the NHS suggests a pragmatic choice intended to minimize disruption during this period of transition. Many senior figures within the NHS believe Mackey is a strong contender for the permanent position, should he choose to pursue it. His appointment signals a clear intention to maintain momentum and ensure the smooth transition of leadership. Streeting's response to Pritchard's departure highlights the significance of the moment. He stressed the importance of the upcoming 10-year plan and the start of the new financial year as pivotal moments on the road to reform. His emphasis on the need for a new relationship between the Department of Health and Social Care and NHS England points towards a broader restructuring of the governance and accountability structures within the NHS. This statement underscores a desire for greater collaboration and clearer lines of responsibility between the DHSC and NHS England, potentially addressing some of the concerns raised by the parliamentary committees. The appointment of Alan Milburn, former Health Secretary under Tony Blair, as the Health Department's lead non-executive director, further reinforces the government's commitment to comprehensive reform. Milburn's extensive experience in navigating the complexities of the NHS provides invaluable insight and expertise, particularly during this period of significant organizational change. His presence signals a strategic move to bolster the department's leadership capacity and ensure effective implementation of the government's vision for the future of the NHS. The confluence of these events, the unexpected resignation, the interim appointment, and the strategic addition of a seasoned political figure, suggests a period of significant transformation lies ahead for the NHS, a transformation that will require strong leadership, effective collaboration, and clear accountability to succeed. The coming months will be critical in shaping the future of healthcare in England.